What are the most common symptoms of COVID? Fever, cough, shortness of breath. It's also common to have body aches. But COVID-19 is sometimes more than just a respiratory disease, or sometimes not a respiratory disease at all. It can mimic just about any illness. Sometimes it looks like a common cold. Sometimes it looks like influenza. Sometimes it looks like a stomach bug with belly pain, diarrhea, maybe some nausea, vomiting, loss of appetite. It can cause pink eye, a runny nose, loss of taste and smell, sometimes even whole body rashes or areas of swelling and redness of the skin in just a few spots. It's also kidney damage, heart damage. This is a section of a heart of a patient who had severe COVID disease. This patient had inflamed lungs with ARDS and tiny clots in his lungs. And that made it hard for his right ventricle to pump blood to his lungs. And that's what caused his right ventricle to weaken and become dilated. Severe disease is causing blood clots to form in a lot of patients. When blood clots are found in the lungs, they're called pulmonary emboli. Some COVID patients have presented with a stroke as a result of having blood clots in their brain. COVID has also presented in other ways, sometimes with seizures, also Guillain-Barré syndrome. This makes it incredibly difficult to diagnose and even harder to treat. This disease can present in so many ways. There's never been a disease in the history of mankind that's presented in so many different ways. When it comes to how this virus invades our body and causes disease, there are some things we know, some things we think we know, and then some things we just don't know. How about we start with what we know? When the virus lands in our eyes, nose, or mouth, or sometimes when we inhale into our lungs, the spike proteins of the virus bind to the ACE2 receptor on the surface of certain cells, and that's how it gains entry. These ACE2 receptors are found in many different parts of the body. Once the virus gains entry, not only does it make millions of copies of itself, but it also alters the cell's ability to call for help. It's like the cells that get infected, they can't call the police, at least not initially. Once the virus is deeply embedded in our body, it begins to cause more severe disease. This is where direct attack on other organs that have ACE2 receptors can occur, including heart muscle, kidneys, blood vessels, liver, and the brain. Early findings, including those from multiple autopsy and biopsy reports, show that viral particles can be found not only in the nasal passages and throat, but also in tears, stool, kidneys, liver, pancreas, and the heart. One case report found evidence of viral particles in the CSF, meaning the cerebrospinal fluid. That's the fluid around the brain. The patient ended up having meningitis. Oh, I forgot to mention that one earlier. So this virus can also cause meningitis, which is inflammation of the membranes that encapsulate the brain and spinal cord. Know that antiphospholipid antibody syndrome, or APS, that just might be the link to explain why so many COVID patients are getting blood clots, like what this autopsy showed in the lungs with blood clots here. Not only did it have blood clots, but these lungs are inflamed and showed findings consistent with ARDS when it was looked at underneath the microscope. These lungs were heavy, filled with fluid, and much stiffer than normal lungs. All these factors make it hard for the lungs to move air in and out. It makes it hard to get oxygen from that air into the blood. And this was another autopsy here where they sliced up small pieces of lung and looked at it underneath the microscope. These are tiny little blood clots within the lung capillaries. And the lining of these lung capillaries is called the endothelium. And this endothelium is destroyed by the virus and by inflammation. This is a picture of the endothelial cells undergoing apoptosis. So apoptosis is a process where the cell programs itself to die, which is what sometimes happens when a cell gets infected. And endothelial cells are more vulnerable to dying in people with pre-existing endothelial dysfunction, which is more often associated with being a male, being a smoker, having high blood pressure, having diabetes, having obesity. And if all these sound familiar, maybe that's because these are all the associated risk factors for worse outcomes in COVID-19. But let's get back to blood clots, because these blood clots can form and or travel to other parts of the body. When blood clots travel to the toes and cause blockages in blood flow there, meaning ischemia or infarction, that can cause gangrene there. And lots of times patients with gangrene require amputation. So here's a picture of what we call COVID toes. And it doesn't just affect toes, it also affects other areas of skin. This is a picture of something we call purpura, which results of capillaries bursting open, which is a result of the clots that are forming there. So is antiphospholipid antibody syndrome, or APS, is that the cause of all these blood clots in patients with severe COVID? Maybe. It's a tricky diagnosis. Some patients with APS have what's called catastrophic APS, or CAPS, CAPS. With CAPS, these patients can have strokes, seizures, heart attacks, kidney failure, ARDS, skin changes like the ones I mentioned earlier in this video. So this begs the question, is this what's going on in patients with severe COVID-19? It sure does look like it. Viral infectious diseases, particularly those of the respiratory tract, have been reported as being the triggers for CAPS. Anyway, you can probably glean from this video why it's so hard for doctors to figure out what is going on with the virus. Between the variable ways this disease can present in different patients and the different ways that organs can suffer damage, yeah, this is really complicated. And we still are just scratching the surface with just how much we know about it. There's so many pieces of the puzzle that we're still putting together, but at least it's starting to form a picture.